Tests for special population. Different types of individual and group tests are designed for special population like infants, preschools, physically disabled or challenged, cross-cultural people, sensory or motor challenged children, etc. The special population tests are designed for those who cannot be properly or adequately examined with the traditional instruments like individual scales. The special tests are performance tests, non-language or non-verbal tests. Performance tests involves manipulation of objects with minimal use of paper and pencil. Non-verbal tests are designated as non-reading tests, example primary preschool children tests, where we need only minimal reading and writing skills. Sometimes they are not required at all. So combination of verbal and performance test of Wechsler scale is the best example. Coming to infants and preschool tests. All tests designed as individual administration. The group tests can be after reaching school age only. So these tests are for less than 6 years age and it can be performed as a performance or oral tests. So the groups included are infants, toddlers and preschooler age groups. All the tests deal with sensory motor development like head hold, grasp reflex, turnover, eye movements, etc. in infants. Preschoolers can walk, sit steadily, manipulate the objects, can speak. So the preschool tests should cover broad spectrum of behavior including motor, social and cognitive skills. After series of longitudinal studies in infants and preschool, Jessel and Associates formed a few developmental schedules for infants and preschool as a special test for them. At each level, this inventory is divided into 4 categories of behavior like motor, adaptive, language, personal or social aspects. Data obtained by direct observation of the child. Infant schedules are 1 month to 4 months. At 1 month, head control, then arm-hand coordination, leg-foot posture, language and social behavior. At 4 months, body posture, progressive comprehension and manipulation of the objects, language, social behavior, etc. Preschool schedule is 4 months to 8 years. The norms produced at age levels of 15, 18, 21, 24, 30, 38, 42, 48, 54, 60 and 72 months. These schedules help in medical examination and in neuro defects and also behavioral abnormalities. The other tests can be tests for motor proficiency, social maturity scale, ABS means adaptive behavior scale. So these are the infants and preschool tests which are special for that age group only. Coming to physical disabilities, deaf. Poor linguistic development is seen in auditory handicaps. Low on verbal tests or functions, even the verbal content presented visually also they cannot grasp, we can say. They cannot get the information. Printer-Peterson performance scale, Arthur performance scale for deaf. Others are typing and questions in cards, special adaptation of Wechsler scales, non-language, group tests, etc. Nebraska test for deaf. It has 12 subjects to test like bead pattern, block pattern, color memory, drawings, picture association and identification, paper folding, visual attention span, digits memory, puzzle blocks, picture analogies and spatial reasoning, etc. Special tests for blind. Oral tests are more suitable than the performance tests. In addition to the oral tests, photo records or tape records in some Braille language also used. Embossed answers sheets available for use with the true or false or multiple choice question items. These are the same of Binet or Wechsler intelligence scales for blind. 6 tests for each year from 8 to 11 levels, 8 sets for average adults level, and for 3 to 6 special tests, mostly in the form of oral tests. Optic intelligence scale for adult blind, that is tactile method. It is non-verbal. It's also used along with verbal scale of ways. From ways, digit symbol, object assembly, object completion are adapted. Other test patterns are weed arithmetic test, 1 to 2 years test. It's clinically visible in valuable in the case of experts only. Means we need to have experts to conduct this test, unless it is not at all reliable. Group intelligence tests like school and college ability test, that is CAT, then SAT, scholastic aptitude test, GRE means graduate record examination, that is GRE, and Vinland social maturity scale. Coming to orthopedic handicaps, they face difficulty making oral and motor responses. It's not feasible to manipulate the test form boards or performance materials. Testing sessions should be short as they cannot endure the long periods of work. Adaptations of international performance scales and Porteous measures is a suitable test for cerebral palsy subjects. In both tests, materials are manipulated while the subject responds by appropriate head movements. Progressive matrices provide a promising tool for this purpose. Like no time limit is seen here. Response may be again oral, writing, pointing or nodding head. So it is the best way of test for these orthopedic handicaps. PVT, picture vocabulary test. It is easy to administer within 15 minutes and used as rapid scoring device where examiner is not available. Test comprises of 150 items. Each has 4 pictures in it. Examiner presents one by one at a time along with a word pronounced, mostly like CP means cerebral palsy clients. A child points to the picture on the plate corresponding to the meaning of orally pronounced word. The test covers an age range of 2 to 18 years, and each examinee is presented stimulus plates suitable for the level of performance. The level of performance is decided by the specified run of successes at one end and failures at another end. The other tests for other groups are cross-culture tests. Examples: IPAT, Institute for Personality and Ability Testing, Raven's Progressive Matrices Test by British, Colored Progressive Matrices for mentally retarded children, that is 5 to 11 years, Droyer-Mann test, Thorndike intelligence tests for cross-cultured people, and all these information supplement with the Stanford, Binet and Wechsler scale of intelligence. So these are few points regarding tests for special population. Thank you.